This is Bianca Martinez, and I'm going to be doing our demonstration videos for week 7 for our pharmacology lab. I'm going to begin with our first patient by pulling them up in the MAR, and the patient is going to be Kelly Garrett, date of birth 2/11/60, here for a diagnosis of malnutrition. She has an allergy to sulfa, and her provider, Dr. Who, has ordered a multivitamin PO daily. I'm now going to begin by walking over to our Pyxis, looking for the multivitamin, which was ordered in an oral form. I'm going to be checking the expiration date, 11/20/37, meaning the medication is still good. I'm going to do my second medication check for Kelly Garrett, date of birth 2/11/1960, diagnosis of malnutrition. She has an allergy to sulfa, and Dr. Who has ordered a multivitamin PO daily. Now that I have the medication, I'm going to go ahead and walk over to the patient's room. I'm going to begin by knocking on the door, closing the curtain for privacy, hand hygiene. I'm going to be introducing myself to the patient. Hi Kelly, my name is Bianca. I'm going to be your nurse today, and I'm here to give you your multivitamin. Is it okay if I check your name down? Can you repeat your name for me? Carrie Garrett, date of birth 2/11/1960. I see you here for malnutrition. Your provider, Dr. Who, has ordered a multivitamin for you. Do you have any allergies? You do to sulfa? Okay, I see that here in your chart. And do you have any questions about your vitamin? No? Okay. I'm going to go ahead and I brought some crackers and juice just to avoid, there's sometimes a side effect of feeling nausea, so that way if you start to feel anyway, you have these crackers and juice to help ease the nausea for you. Okay, I'm going to go ahead and do my third medication check for Gary Kelly, 2/11/60, here with allergy for sulfa, and I'm going to be giving her the multivitamin. Do you have any problems swallowing this, Kelly? No? Would you mind drinking a sip of water for me? Now that I've made sure she has no problem swallowing, I'm going to go ahead and administer the medication. There you go. There's some water. Discard the trash into the garbage bin. Hand hygiene. Do you have any questions for me, Miss Kelly? And like I said, I'm going to leave these crackers and juice right on your table in case you start to feel a little bit nauseous. But other than that, I'm going to leave your call light right next to you, and if you need anything, don't hesitate to give me a call. Before we leave the room, I'm going to document that Kelly Garrett was given her multivitamin that Dr. Who has prescribed. Moving on to our second patient, it is going to be, that I'm pulling up in the MAR, it is going to be for Pat Benatar, here with a diagnosis of hypothyroidism. She has an allergy to sulfa, and Dr. Who has ordered Synthroid 100 micrograms PO daily at 6 in the morning. Now that we did our first medication check, we're going to go ahead and walk over to the Pyxis. The Synthroid was ordered in an oral form. Once you have the pill, you're going to make sure that it is not expired. The expiration date is for 10/20/38, meaning the medication is still good. We are going to go ahead and do our second medication check for Pat Benatar, date of birth 8/14/1956, here with the diagnosis of hypothyroidism, and Dr. Who has ordered Synthroid 100 micrograms PO daily at 6 a.m., and she does have an allergy to sulfa. Now that we have our medication ready, we are going to go ahead and walk over to our patient's room, begin by knocking on the door, closing the curtain for privacy, hand hygiene. We are now going to introduce ourselves to the patient. Hi Pat, my name is Bianca. I'm here to give you your Synthroid that Dr. Who has prescribed. Do you have any questions about the Synthroid? So Synthroid is just a medication that we are going to admit that is going to help monitor your glucose levels or help normalize it. Before walking into the room and giving them, I forgot to mention, giving the patient the medication, you do want to check the patient's lab to see how their thyroid levels are doing. So it's just to help regulate the medication again, Pat, it's just to help normalize your thyroid levels. Is it okay if I check the name on your name bag? I'm going to be doing my third medication check. Can you repeat your name for me? Pat Benatar, date of birth 8/14/1956. Okay. Do you have any allergies? You do to sulfur, I see here. Okay, now that we've done the second medication check, I'm going to ask them if they have any issues swallowing. Would you mind having a sip of water for me, Pat? Now that I've seen that they have no issues swallowing, I'm going to go ahead and administer the medication to the patient. I have his Synthroid right here at 100 micrograms. Here's the medication, Pat. Have some water. I'm going to go ahead and dispose the garbage into the garbage bin. Hand hygiene. Alright, Pat, like I mentioned, the medication is just to help regulate your thyroid levels. Once you leave from the hospital, we are going to want you to keep a close eye on your weight. I recommend taking the medication in the morning, and if you for some reason start feeling any chest pain, dizziness, or palpitations with your heart, I would recommend calling your doctor immediately. I'm going to go ahead and leave the call light right next to you, and if you have any questions, don't hesitate to let me know. Okay, before you leave the room, I'm going to document that Pat Benatar, date of birth 8/14/1956, was given her Synthroid medication, 100 micrograms PO daily at 6 in the morning. That was prescribed by Dr. Who for her hypothyroidism. Our next patient is going to be Mickey Jackson, that I'm pulling up in the MAR. The date of birth is 10/31/60, diagnosis of diabetes mellitus. He has no known drug allergies, and Dr. Who has ordered 6 units of regular insulin subcutaneously now. Now that I did my first medication check, I'm going to go ahead and walk over to our Pyxis. The insulin is being ordered in injection form, so I'm going to go ahead and prepare it. Here. Insulin, my needle, and my alcohol wipes. I'm going to put on my gloves. I'm going to pop open the insulin. Before putting on my gloves, I am going to do my second medication check. It is going to be for Mickey Jackson, date of birth 10/31/1960. Here with the diagnosis of diabetes mellitus. He has no known drug allergies, and Dr. Who has ordered 6 units of regular insulin. Now that we did our second check, I'm going to begin by cleaning the top of the insulin. Open our needle very carefully, not to bend the needle. Now that the top of the vial was clean, okay, I'm going to flip it up, carefully going up to 6 units, making sure there's no bubbles in the syringe. The one-handed method, carefully putting the safety back on the needle. And usually in the hospital, I'm going to be removing my gloves. There should be a little sticker that pops out saying that there's 6 units of insulin in the injection. Before you leave the medication room, it is important to have another nurse verify that there's 6 units of insulin in that. in that injection. I'm going to grab the needle. So like I said, I'm not going to be wearing gloves. Now that we have the medication ready, we had our second nurse verify. It is time to go into the patient's room. We're going to begin by knocking on the door, closing the curtain for privacy and hygiene. Introduce yourself to the nurse. Hi Mickey, my name is Bianca. I'm going to be your nurse today and I'm here to give you your insulin shot. Realizing that they're taking insulin, they're probably used to know what it's for. It's going to help regularize your glucose levels, which is monitored with your daily blood draws. And it's going to help lower your glucose levels if they are elevated. Do you have any questions for me? Before administering the injection, I am going to do my third medication check. Do you mind verifying your name and date of birth for me while I look on your name then? Mickey Jackson. Date of birth 10/31/60. Okay. I see you're here for your diabetes, which is why we're giving you your insulin. Do you have any allergies? No known drug allergies. Okay. Do you prefer having your injection in your arm or in your belly? In your belly? Okay. I'm going to go ahead and put on my gloves. I'm going to be cleaning the area where I'll be putting the injection in. Waiting for the area to dry. And with Mickey being a heavier patient, we are going to go in at a 90-degree angle, but we're not going to do it. It's going to be away from the belly button. I'm going to cut my needle. Grab an inch skin. Go directly down at 90 degrees. And inject. Pull out. Carefully capping our needle. We are going to discard it in the sharps container. I'm going to remove my gloves. And hygiene. Okay, Mickey, if you start to feel any pain in your injection site, please let me know. That way we can monitor the area. If you start to feel any lightheadedness with fast movements, don't hesitate to give us a call. I'm going to leave your car light right next to you. And if you need anything, like I said, just give us a call. Before you leave the room, we are supposed to document that Mickey Jackson, with the date of birth of 10/31/60, was given his 60 units of regular insulin for his diabetes mellitus that was prescribed by Dr. Who.